and say that again. So just to reiterate, so that it's on the recording, your exam will cover chapters 20, 21, and 22. We are starting chapter 23 this week. It will not be on your exam on Saturday. Okay? I'm going to set it up so that your exam will open. I think I'm going to open your quiz on Thursday. So I'm going to open your quiz on Thursday. It will be open Thursday, Friday, Saturday, and Sunday. And I'm going to open your exam on Friday. And it will be open Friday, Saturday, and Sunday. Does that work for you guys? Okay, cool. Hang on a second. Are you going to go back in your room and talk to her? Yeah, I'm going somewhere else. Okay, thank you. My mother's FaceTiming with my sister. I'm like, I can't. I understand. She's having a rough day. Okay, so we are covering the first 3 sections of chapter 23 today. So chapter 21.1, 21.2, 21.3. Okay? Which I think is mostly anatomy, if I'm not mistaken. So we're going to flip through these. Just like last time, if we get done early, we get done early. Ask questions if you have them. If there's something you don't understand, make sure that you're asking questions. The more questions you ask me, the more help I can be for you. Okay? So, any questions about the structures in this list? Everybody has a general idea of what these are. As we move forward, we're going to get to see pictures, I'm sure, but the whole point of the respiratory system. Actually, let's make this our first participation question for the day. The whole point of the respiratory system is what? I love my family. Anybody have a guess? I can't see the chat. Gas exchange? Gas exchange, yes. Raise your hands so that I can, because I think I saw it pop up in the chat, but it pops up and goes away so fast I can't see it. So talking to me is a better plan here. All right, moving forward. You guys understand the difference between the upper respiratory tract and the lower respiratory tract, right? Anybody have any questions about this? Cameron.
I did see some conflicting information on whether the larynx is part of the upper respiratory or lower, so I just wanted to clarify that it is upper.
We are going to consider it upper. I'll be honest with you, you're not going to use the phrase upper respiratory much or lower respiratory much in reference to the larynx, right? When you're talking upper or lower respiratory, you're talking about, generally you're referring to some sort of condition, right? An upper respiratory disease, a lower respiratory disease, those sorts of things. Very rarely is that going to include the larynx or involve the larynx. So it sort of shifts around in between. It's right there at the border. So for our purposes, we'll consider it upper, and just go with that. Does that make sense?
Yes, thank you.
You're welcome. Good question. Okay. This is really important. So, do we have questions about this? The difference between ventilation and respiration is extremely important, right? We talk about respiration all the time. We very rarely talk about ventilation. But you need to understand the difference. So somebody explain to me what the difference is without reading your PowerPoint to me. How would you explain it to your grandma? Faith.
Respiration involves like blood to other places, and then ventilation is directly from the air and the lungs. Does that make sense?
Sort of. You're sort of on the right track. But what I would counter with is, if that's the case, then what is the difference between ventilation and external respiration?
I think ventilation is more like the volume of air in the lungs.
It's about moving the air into the lungs. So think about it this way, okay? Think about, and this is timely, when people in the hospital end up on a ventilator. What does that ventilator do for them?
Helps their lungs, or their, I guess, diaphragm contract.
What is it? Well, no. So the ventilator doesn't actually have anything to do with diaphragm contraction. Alyssa.
It like breathes for you.
More specifically than that, what exactly does it do?
It's like moving the air through passages between the atmosphere and the lungs.
Yes, that. It's moving air. Okay, that's all it does. It moves air in and it pulls air out. Okay? That is ventilation. That is all ventilation is. Okay? When we talk about breathing includes the process of exchanging oxygen and carbon dioxide between the blood and the lungs. Right? So breathing is a combination of ventilation and respiration. Okay? So when air moves into my lungs, I am ventilating. When air moves out of my lungs, I am ventilating. But when, in between there, oxygen and carbon dioxide exchange places between the blood and the lungs, I am respirating. Okay? Respiration is a very specific thing. It is just the exchange of carbon dioxide and oxygen between the tissues or the lungs and the blood. Okay? You can even make it more simple and say respiration is simply the movement of gases into and out of the blood. Okay? Now that movement of gases is going to happen in broadly speaking, two places, right? One of those is what? Where is the most commonly thought of place where blood and carbon dioxide and oxygen switch places? Aaron? The lungs. Aaron, do you have your hand up because you have a question or because you forgot to put it down?
I forgot to put it down.
Okay. So the lungs is one of those places, right? The lungs is where the blood is able to exchange carbon dioxide for oxygen. It gets oxygen that just came in from the atmosphere, and it gives up oxygen to send out into the atmosphere. Okay? So when I am exchanging gases between the lungs and the blood, I am exchanging gases that are either coming from outside of the body or are going to outside of the body. And therefore we refer to that as external respiration. Does that make sense? Anybody confused by that? Okay. Now, where is the other place or places that gas exchange takes place? We actually talked about them last week. Alyssa.
Isn't it like, I know it's like in the lungs, but isn't it like in those blood vessels?
Well, so we already covered the lungs, but there's someplace else that's not the lungs.
Is it the, I don't know how to say it, it's like the alveoli.
So the alveoli are in the lungs, and that is where external respiration takes place. So you're on that one.
Okay.
Where else? So if external respiration is the exchange of carbon dioxide, moving carbon dioxide out of the blood and moving oxygen into the blood, where are we going to have another kind of gas exchange? Where am I going to move oxygen out of the blood and carbon dioxide in? Cameron.
The capillaries.
The capillary beds that are all out in the tissues, right? We talked about artery to arterial to capillary, and then the capillary's whole purpose is gas exchange, right? That's the whole purpose of capillary beds. So that is another place where we have respiration. The only difference between that and what happens in the lungs is that the gas that is in the blood and the gas that is in the tissues is not coming from directly or going to directly the outside of the body, right? The tissues are inside of the body. They're making the carbon dioxide. And the blood that is being pumped out of there has gone back through the heart at this point. So it's coming from inside of the body. And so we refer to the gas exchange out in the tissues as internal respiration. So, and I'll show you a diagram of this in a minute, but if you wanted a way to sort of depict this for yourself, you could draw yourself a couple of lungs, right? And draw yourself just some, tissues down here in the body. We'll label this tissue. Okay. Looks sort of like a little smiley face. Right? And so I'm going to take blood, and any blood that comes through here, right? And through here is going to come to the heart. Okay? And that blood is then going to come out of the heart and go into the tissues, and then from the tissues back to the heart. So what we've got here, up here at the lungs, is external. So O2 goes into the blood, CO2 goes out of the blood. And then down here we have internal respiration, where CO2 goes into the blood, and O2 comes out of the blood. Okay, you're just swapping, right? I make carbon dioxide in the tissues, I exchange it for oxygen in the tissues, so oxygen will leave the blood, carbon dioxide will go in. You guys following me here? This is one of the hardest things for people to get. So once you get this part, the rest of it gets pretty straightforward. Okay. So, ventilation and respiration happen in different places. Okay? So that is not to say that when we talk about the lower respiratory tract containing the trachea through the alveoli, that doesn't mean that respiration takes place in the lower and ventilation takes place in the upper. That is not appropriate. Okay? So yes, you want to know what is part of respiration, But more important than that, you want to know what the conducting zone is and what the respiratory zone is. Okay? The conducting zone and the respiratory zones are the places where you can separate where ventilation is happening and where respiration is happening. Okay? So, which do you think is the place where ventilation happens?
The constricting zone?
The conducting zone. So this is where ventilation happens. Okay, and this is where respiration happens. Nothing of any consequence to your body happens in the tubing that goes from your nose and your mouth all the way down until you get to the tiniest of the bronchioles. Okay? All of that tubing is just a place to conduct air, to move air from point A to point B. Okay? All of the really important stuff, the external respiration, takes place in the respiratory zone. Does that make sense? Okay. Any questions about bronchodilation and bronchoconstriction? Everybody's good with bronchodilation and bronchoconstriction. It's very similar to vasodilation and vasoconstriction. So, all right, cool. We're going to move forward then. Questions about the functions. We've already talked about ventilation. We talked about pulmonary and systemic respiration. We've described these as something else. Pulmonary respiration could also be referred to as what?
External respiration.
External respiration, yes. And therefore, systemic respiration could also be referred to as
Internal respiration.
yes. Thank you, Aaron. Okay, so pulmonary and systemic, which we talked about when we talked about the circulatory system and the cardiovascular system, they come into play here, right? External respiration happens through the pulmonary circuit. Internal respiration happens through the systemic circuit. Questions about any of the other functions? Okay. Moving forward. Questions about structures in the histology, any of the structures. I'm going to probably flip through these pretty quickly because most of this is just identification of structures, but if there's something that you're like, I just don't understand what it is I'm looking at, then we'll talk about it. The pharynxes. Does everybody understand how to locate each of the pharynxes? This is more lab material at this point. Questions here. You do need to know which of the cartilages are paired and which ones are unpaired. And you should know the ligaments that are in what we call the ligaments in relationship to the vestibular folds and the vocal folds. Those are the ones that you need to understand. Vestibular folds versus vocal folds. Does that make sense? Okay. pictures of those. You guys should be really happy if you were in the lab. You would actually have models of these that you would have to identify these structures on. Functions of the larynx, questions here. You're not going to be asked to label like the major structures here. Okay? You just need to know that what they are. Questions about the trachea.
Do we have to know what type of cell and tissue and everything that goes involved with the
So that's going to come up more in the lab than it is in the lecture. So as you go through the lab material, any of the histology slides, you always want to pay attention to where you would find the tissue that you're looking at. What is the slide you're looking at? What kind of tissue is it? So that you can start to make connections between those things. Okay? Again, more lab than lecture. These pictures are here mostly to help you as you look through the histology in the lab and start to identify some of those parts and pieces. Questions about the bronchi? Questions about the tracheobronchial tree? Everybody understands how these branches, this really looks like a tree. I don't know if I have a pic listed for you here. Okay, so your main bronchi split off, right? And that split point where they branch off is the carina or the carina, however you want to say it. They branch off into the lobar or secondary bronchi. The secondary bronchi branch off into the segmental or tertiary bronchi, and they get smaller as they go, right? The bronchioles branch off into the terminal bronchioles, and then we'll get even smaller as we get into the respiratory side of it. Okay? At this point, we are still in the conducting zone. Okay? You are in the lungs, you are inside of the body, but you are still just conducting air. Okay, you're just from the terminal bronchioles. In here, I do. So if you turn this sucker upside down, hang on. You look at it upside down, it looks like a tree. Right? So that's why we call it that. So you just have to think of it as an upside down tree. To help you keep track of what branches into what, and they're moving air. We've come down, okay? Okay, bronchodilation, bronchoconstriction, and those terminal we've already talked about. All right, moving into the alveoli. This is where we usually start to get into trouble. So we've bronchioles are going to split off into tiny, tiny little branches called respiratory bronchioles. Okay? And the respiratory bronchioles, some of the respiratory bronchioles will have some alveoli, so they are part of the respiratory zone. Okay? There aren't many, but there are some. The alveolar ducts that branch off of the respiratory bronchioles are where you are going to start getting into your actual alveolar sacs. And the alveolar sacs contain all of the alveoli. So if you think of the alveoli like a bunch of grapes at the end of a branch, right? Each little round ball is an alveolus individually, right? The whole bunch of them together is an alveoli, and they are wrapped up in a little sac called an alveolar sac. Okay? Well, the chamber that connects two or more at the end of a duct is the sac. Does that make sense? Okay? This image is actually going to be really helpful to you. Okay? first of all, there are no cilia inside the alveoli, so any debris that gets into your alveoli is dealt with by macrophages. They pick them up and take them off to the lymphatic tissue. But I want you to pay attention right here to how the blood vessels are wrapped around the alveoli. Okay? It's not just laid up against, they're all wrapped around and inside, like in between each of the alveoli, right? Why do we want our capillaries wrapped all up around the alveoli? What does that do for us?
So gas exchange?
It helps with gas exchange, right? But I could still get gas exchange if I just had just, a couple of them laying down across the capillaries. What do I get by having multiple vessels wrapped around? Alyssa?
Isn't it because they have like the thin walls, so it allows the oxygen to pass from the alveoli into the blood?
That is how gas exchange takes place, yes. But why does having the capillaries wrapped around the alveoli make that easier? What does it increase?
The amount of gas exchange.
The amount of gas exchange, the surface area, right? The more capillary I have against the outside edge of that alveolus, the more surface area I have where I've got that connection, I have greater opportunities for gas exchange. So it makes the process faster. All right. This is the inside of an alveolus. One single alveolus. Okay. Questions, Alyssa?
I actually had a question. When we were doing the reading assignments, I was having trouble. Does the capillaries, does it have deoxygenated or oxygenated?
So the capillaries that are carrying blood into the lungs is deoxygenated, right? The goal is to exchange. So the capillaries come in carrying carbon dioxide. That carbon dioxide is exchanged with the alveoli, so the alveoli give oxygen to the blood and take up carbon dioxide. Okay? And then the blood that leaves in the capillaries as it leaves the lungs and goes out into the pulmonary veins, that is oxygenated. So it depends on where you're talking about in the process.
Okay, thank you.
Mm-hmm. Any questions about the type 1 or type 2 pneumocytes? No questions? It's got more to do with their function, right?
Okay.
So the function of the thin squamous, God, I can't talk today, squamous shaped cells is what? So type 1 pneumocytes, their job is what?
It's for gas exchange.
Right. So the gas exchange requires a very thin membrane. Okay? Type 2 pneumocytes don't do gas exchange. Their only job is to produce surfactant. Okay? And so they're going to be cube shaped because they need to be able to produce a lot of surfactant to be able to secrete it and produce and release it into the alveolus. What is the purpose of the surfactant? I think we're going to get to that in another slide. Hold on to that question, actually.
Okay.
Quinn.
So I know it was talking about the thin squamous and like the difference of like shapes, but why is it like shaped a certain way? Is it just because of like the structure or like?
Are you talking about the squamous cells?
Yes.
Okay, all squamous cells are shaped the same way. They're called squamous cells because of their shape. Right?
No, but I'm saying like for like the type 1, type 2. Can you just like go in?
Oh, talk about it when we get there. Okay. So, the respiratory membrane. Questions here. Everybody understands the layers and why it's important. So if I have an oxygen molecule that is going to be diffused in this situation, what is the first layer that it is going to go through in order to diffuse through the respiratory membrane?
Is oxygen the red arrow here?
Yes. How would you know that?
Because it says diffusion of oxygen.
Well, other than
Which
the
is
fact
very
that it
odd.
says diffusion of oxygen. Hang on, let me blow this up a minute. Okay, if we can't see the labels, I've now removed the labels. What about that arrow tells you that this is oxygen?
It's going onto the red blood cell,
It's coming from where?
the alveoli.
It's coming from the alveolus into the blood. When you breathe in, do you breathe in oxygen or carbon dioxide? That should be an easy question. We breathe in oxygen. Yes, we breathe in oxygen. So oxygen coming into the body is always going to go from the alveolus into the blood. Right? So given that, what is the first layer that the oxygen molecule is going to go through in order to diffuse across the respiratory membrane?
Alveolar fluid.
The alveolar fluid, right? It's going to go through the alveolar fluid. So oxygen, oops, give me a pen. Oxygen, okay, O2, is going to go this way, right? What about carbon dioxide? What is the first part of the respiratory membrane that it's going to cross? Mackenzie. Mackenzie.
I was going to say the red blood cell, but I could be wrong.
Okay, so the red blood cell is, so what you want to pay attention to is the respiratory membrane. Right? So just these pieces are in the respiratory membrane.
So then the pulmonary capillary.
The pulmonary capillary endothelium. So that means that I have pulmonary, so I'm in the lungs, right? I'm in a capillary. That's the capillary. And endothelium means what? Anybody?
I think of inside.
Yes,
Inside.
it's the inner layer, right? It's the inside wall of the capillary, okay? So I've got carbon dioxide that's going through the pulmonary capillary endothelium, then it's going to go through the basement membrane of the capillary endothelium, then it's going to go through the space between the capillary and the alveolus, then it's going to go through the membrane of the alveolus, through the alveolar epithelium, into the alveolar surfactant, and where is it going to go after that? Once it gets into the alveolus, what happens to it? Where is my carbon dioxide going to go? I know my O2 is going to go to the red blood cell. Where is my carbon dioxide going to go?
The alveolus.
Well, it's already in the alveolus because we've crossed into the alveolar fluid. Where's it going to go once it's in the alveolus?
The lungs.
Okay, and from the lungs, it's going to go where? It's just going to stay in the lungs?
Outside the body.
Outside of the body, right? This is you breathing out carbon dioxide. Okay, so when we breathe in, oxygen comes in and goes to the red blood cell. When we breathe out, carbon dioxide leaves the body, right? And in order for them to do that, they both have to cross this respiratory membrane. You guys need to really take a look at this respiratory membrane and understand the order that things are going to happen here. Does that make sense? Okay. I'm not sure what happened to my this. I'm going to make you smaller so that I can then make you smaller so that I can make you a little bigger. Okay. Moving forward. Muscles of respiration. Questions about the diaphragm or the change in cavity size. This particular concept is really important. Okay? So when you look at the size of the cavity, let's go with black because black will be easiest to see here. We are talking about the size of this cavity, okay? The size of the cavity that the lungs fill, okay? When you inhale, okay, everybody do this. Put your hands like right on around your rib cage. Put your hands right around your rib cage. Take a deep breath in. What do you feel happen to your hands and to your rib cage? Does it stay the same size?
Expands.
It expands. It gets bigger, right? If the rib cage expands, then it allows for the lungs to expand, okay? So the cavity where the lungs are gets much bigger, okay? So this space compared to this space is different in size, right? The cavity got bigger, okay? Now, that is going to be really important in a few minutes, okay? Now, the other thing I want you to pay attention to here is what happens to the diaphragm, okay? So I'm going to erase my lines here for a second. When you look at the diaphragm, okay, when I'm here, it looks like almost like a little bell, right? When I breathe, when the diaphragm contracts, it actually flattens out, okay? So it goes from being shaped like this to being flat, okay? So relaxed, it's in a bell shape. When it contracts, it flattens out, okay? Does that make sense? Because that comes into play in terms of how I make this cavity so much bigger than this cavity. Okay? So all of that is really important to remember. That picture, this one. Okay. Questions about the lungs themselves, any of the structures that are talked about here? Questions about lobes or bronchopulmonary segments. I'm not going to ask you to identify all the different bronchopulmonary segments. I want you to know that they exist. But all of this down here, I'm not going to ask you to break it down to that level of detail. Okay? You should know the different lobes and what the lobes are called, but I'm not going to ask you for all of the different segments. You guys should remember pleural cavities from A&P 1. Does anybody have any questions about these? This is just another picture, another image where you can sort of see the pleural cavities. So they're in here, right? This space is the pleural cavity. Now, one of the things that we're going to talk about probably next week is the pressures in the different cavities. And there is a particular pressure in that space that plays a role in respiration. We'll talk about that when we get there, okay? Hang on. Okay, so we are talking now about the muscles of inspiration. Now, these are not the ones that inspire you to write great literature. Okay, it's not that kind of inspiration. Inspiration is the process of moving air into the lungs. Okay, inspiration is half of ventilation. Expiration is the other half when the air goes back out. Okay, you should know in general which muscles are inspiration muscles and which ones are expiration. I'm not going to ask you to identify them, but if I gave you a list, you should be able to identify the ones that are expiration and the ones that are inspiration. Okay? You should also be able to tell me what's going to happen to the cavity, the thoracic cavity, when they are activated. Okay? So when you contract your inspiration muscles, your cavity gets bigger. When you contract the expiration muscles, the cavity gets smaller. Okay? That picture. Okay, good old boil. This should look familiar. Okay, or at least it should be when I do this. So the relationship between pressure and volume is such that if pressure increases, then what had to have happened to the volume?
Decreasing.
Volume had to have decreased. So if volume increases, then what happens to pressure?
Pressure has to decrease.
Pressure then has to decrease. Okay? This right here is the entire foundation of how your respiratory system works. Okay? The relationship between volume and pressure drives the entire process of your respiratory system. Okay? Now, when I talk about volume in the respiratory system, what am I talking about?
Air.
I'm actually not talking about air. I'm talking about a space. What space have I been talking about getting bigger and smaller in relationship to contraction?
The lung, the diaphragm.
The thoracic cavity, right? So if I have my thoracic cavity, actually, let me. Okay. So if I have this, okay, when my diaphragm is relaxed, am I going to be in a position where my volume is the biggest or the smallest? Normally. Is it going to be, so okay, let me do this way. This is A and this is B. Is the volume of A higher or lower than B?
Lower.
It's lower.
Lower.
Okay. So that would tell me that the pressure inside of A is
Higher.
higher. So the pressure of A is higher than the pressure of B. Does that make sense? Okay. Keep this in mind. If the volume of A is greater than the volume of B, then the pressure, or I'm sorry, is less than the volume of B, then the pressure of A has to be greater than the pressure of B. Okay? Keep that in mind because it's going to help you. All right. Questions about lung measurements? Okay. So, before you start asking questions about lung measurements, these are definitions. Okay? And definitions are important and will help you understand the graph that we're going to look at. That bad boy. Okay? You need to really understand these definitions. This is something that you will do a lot as a nurse. Checking lung capacities and measuring lung volumes. You're going to be doing, this is something you could theoretically do quite a bit. Okay? So it's really important that you think about and really understand what the different volumes are and what the different capacities are. Okay? Now, one of the things that will help with that is for you to understand that a volume is a single measurement. Okay? A volume is always a single measurement. A capacity is a combination of measurements. Okay? Do you see that? Minute. Okay? Okay, so let's look at, so there's two figures here that I've included in your PowerPoint. There's this, depends on how your brain works as to which you prefer to, we'll look at this one first. And what you see here is your volumes and your capacities. Okay? So the most important one that you really need to understand is tidal volume. Okay? Tidal volume is basically that. Okay? It is the difference between, let me erase this. Your tidal volume is the amount of air that you breathe in and breathe out in a single ventilation. Okay? On a normal day, when you're just sort of sitting, when you're sleeping at night, right? When you're just breathing regularly and you're not thinking about it, tidal volume is your normal inhale and exhale. Okay? Anytime you see a peak on this graph, that is an inhalation or an inspiration, right? Anytime you see a valley, that is an expiration. Okay, so tidal volume is a normal inspiration and a normal expiration, what the difference is between those. So that's where you get your single measurement. Okay? Now, the maximum amount of air that I can breathe in. So if you take the deepest breath you can take, that's going to get you your maximum inspiration volume. Okay? So it's going to start here, and it's going to go all the way up to the most amount of air you can breathe in. And then when you exhale, it's going to come back down. Okay? The most amount of air that you can breathe out, if you force out as much air from your lungs as you possibly can, we're going to call that your maximum expiration or your expiratory reserve volume. So your maximum inspiration is your inspiratory reserve volume. Your maximum expiration is your expiratory reserve volume. Okay? You cannot physically remove all of the air from your lungs unless you die. Okay? If you removed all of the air from inside of your lungs, what would happen to your lung?
It would collapse.
It would collapse, and you wouldn't be able to breathe anymore, and then you would die. Okay? So what's left in your lungs, after you blow out as much air as you can physically blow out, what's left is what we call the residual volume. Okay? Do the volumes make sense? Does anybody have questions about the volumes? Okay. If I combine the residual volume and the expiratory reserve volume, I get what is called the functional residual capacity. Okay? And all that is basically the amount of air that you hold on to in your lungs after your tidal volume. It's not a terribly useful number, honestly. Okay? Unless you're adding it to something else. Your inspiratory capacity is what? How would you define inspiratory capacity?
Is it inspiratory reserve volume plus the tidal volume?
Yes. Your inspiratory capacity equals inspiratory reserve volume plus tidal volume. Okay? What about vital capacity?
Expiratory reserve volume plus inspiratory capacity.
So vital capacity would be expiratory reserve volume plus what?
And what you do for inspiratory.
So right, so you could do this. You could do this one of two ways, right? There's a couple of different ways you can calculate this. So vital capacity equals expiratory reserve volume plus tidal volume plus inspiratory reserve volume, right? That is a true statement. You can also say that vital capacity is expiratory reserve volume plus inspiratory capacity. Do you see that? Okay. What about total lung capacity?
All of the above.
All of the above, right? It's your residual volume plus what? What's the easiest way to calculate that?
Vital capacity.
Right. It's your reserve volume plus vital capacity. Or I could do TLC equals ERV plus TV plus IRV plus reserve volume. Right? You can do it either way. They both come out the same. Okay? You need to know how to manipulate these things. What is the value of understanding total lung capacity?
Is it total lung function?
Total lung function, right? It helps you to understand how the lungs are functioning. If you have there's sort of an average, right? A normal total lung capacity, right? If my inspiratory reserve volume is decreased, what could be causing that? So what would that look like? If my inspiratory reserve volume decreases, if IRV goes down, what would that look like if you were talking to a patient? What would you notice that would be a symptom of that?
Shortness of breath.
Shortness of breath. They'd have a hard time getting air in, right? So that could be caused by a number of things. Can anybody think of something that would cause that? Asthma, right? Asthma is going to cause a change in your IRV, okay, which is going to have an effect on your total lung capacity. It's going to increase your body's oxygen capacity, carrying capacity. Does that make sense? Do you guys see the value in understanding these different pieces and how they work together? Okay, cool. Moving forward. And there's this one. Look at. Okay? They both tell you exactly the same thing. Okay? So this is exactly the same thing. It's just labeled differently. So if this works better for you, work with this. If you need to draw this out, and I encourage you to draw this out and label it yourself so that you really understand what everything is, that's what you need to do. Okay? You need to understand these. This will come up in both the lecture and the lab exams. Okay? This is a big deal. All right. These are more definitions. Anybody have questions about any of these? No questions? You need to know the definitions of the laws and the coefficients, but I'm not going to ask you to do anything with them. Okay? So if you see something that asks the question about, what is used to measure how soluble a gas is in a liquid, you should be able to pick out solubility coefficient as the answer to that. Make sense? So I'm going to give you guys a choice. We have 10 more slides, and this whole PowerPoint is all we're supposed to cover this week. So I can let you go now, and you can plan to either attend Wednesday or Thursday. So I think I told you guys Wednesday, I will hold class on Wednesday if you guys want to show up. Okay? If you want to show up, I will hold class on Wednesday, and we will finish this PowerPoint, and then I'll post the video. If you can't make it Wednesday, or you don't want to come on Wednesday, but you do want to come to a live class, you can come to the Thursday class. It's in the same WebEx session. I will tell you that it is harder for you guys to ask questions because I'm teaching in a live classroom. I'm teaching live in a face-to-face setting there, so I don't see the chat, but I do have 2 people that are answering questions in there. And if you ask a question and they can't answer it for you, then they will ask it, or I will answer it later. So first question is, do you guys want to come to class on Wednesday? Got a few yeses, mostly no's. So those of you who want to be here on Wednesday, I will be here on Wednesday at 11:45. If you are not going to make it, let me know. I'm basically going to do on Wednesday what I do on coffee hours. If I log in and nobody's here within 15 minutes, I'm logging off. Brittany.
On Wednesday, is there going to be participation questions for that one?
There will be participation questions from the Wednesday session, but they will not be due until Saturday. They're just like anything else. So if you can't make a class, then you watch the video and submit the participation questions. So it's the same deal the only other option is for me to give you just a video recording that you're then going to have to watch on your own without anybody having asked questions. So not as helpful, not as much fun. Okay. So I'm going to go ahead and let you guys go because the rest of what we have left in these next 10 slides is really complicated. And I don't want to get started in the middle of it and then have to stop. Bianca.
Was there a participation question
There was
for today?
one.
I came a little late.
There was one earlier. I don't remember what it was. If somebody wants to throw it into the chat, they're welcome to do that. And that's all we need for that. Any other questions? Enjoy your spring break if you're going to take advantage of the day off. If you're not going to take advantage of the day off, then I will see you on Wednesday. Otherwise, have a good one. Okay.